Up to 85% of people will suffer from some form of back pain in our society. It's insidious, it's costly, it costs time at work and money. Hi, I'm Dr. Brian Huggins. We're going to talk a little bit about non-surgical spinal decompression and answer some questions that you may have about this new therapy. Now, most of the people that have had these type of problems have gone to chiropractors, physiotherapists, medical doctors, massage therapists, and the list goes on to try and correct their type of back problem. But when the disc is involved, or it gets too, intense for some of these interventions, there's one step before surgery, spinal surgery, and that's called spinal decompression. Now, you may or may not have heard about non-surgical spinal decompression. It's very prevalent in the newspapers, you even see it on television. And what a lot of people seem to think is that if you buy this $150,000 machine, it's magic. Well, I need to tell you that's just hyperbole. The reality is that we must define what your actual problem is, make a diagnosis, and find out if non-surgical spinal decompression is good for you. There's a number of cases that it's good for, and those that it, quite frankly, isn't any use for. Well, one of the reasons we brought spinal decompression to Alliance Healthcare, or why anyone would incorporate it into their practice, in my opinion, there are some of those difficult cases, disc, deep facet, where there's pain down the leg, and quite frankly, the conservative methods that we use by adjusting, we're not getting the results we wanted. This is just another tool to help patients who are in distress. Now, what spinal decompression actually is, if I can use this model for a minute, I'll demonstrate it a little bit. In between each vertebra, there's a disc. Now, there's a certain pressure in this disc. It has fluid in there. What spinal decompression does is it creates a negative pressure by pulling on the longitudinal axis this vertebra apart, and it creates this negative pressure in the disc so that the nutrients can come back and healing can begin. Risk factors. Now, these risk factors that we take into consideration, for example, if there's been a fracture, a recent surgery, if there's severe osteoporosis, if there is any tumor or cancer in the spine or in the area. Typically things like these we rule out first before we would subject a patient to any form of non-surgical spinal decompression. Spinal decompression is particularly effective for certain disc problems. And when I refer to the disc, again, it's this little shock absorber in between the two vertebrae. Chronic facet problems will respond well. The facet is this joint in here. Encroachment of the nerve allows this decompression, so it's very effective there. Certain movement disorders, sacroiliac, lumbar dyskinesia, things of that nature are very effective when utilizing spinal decompression. Now, modern non-surgical spinal decompression consists of three components. There's a computer-assisted traction unit. Now, what that does is allows us to put a logarithm in for different pulls, different rests, different weights. The second component is a table, of course, where the patient lays either face down or face up. And the third component is a harness system that straps the patient in and allows the traction unit to pull in a specific direction, a specific weight, a specific time. Find out if your doctor is Kennedy certified. Now, Dr. Kennedy developed protocols, and he puts on courses specifically for spinal decompression. And he's certified doctors across Canada, the United States, as a matter of fact, all over the world. So it's not really the machine that is the magic pill. It is the technique that is involved with that machine. So if anyone wants to use spinal decompression, one of the first things you need to do is find out if they are Kennedy Technique certified.